right, we are going to talk about our mannequin Apollo. Apollo is a high fidelity mannequin that is able to allow you to perform a lot of your assessments as well as a lot of your interventions. So on our assessments, on our head to toe, on our face on Apollo, you can be able to assess for pupil response by shining a light on one side. You'll be able to elicit a response if he has that. If there is any fluids on him, you'll be able to see that. You are able to assess for airway. Please do not put anything medication-wise in his mouth. If you're giving him anything, go ahead and bring it to him and verbalize that you're doing that. As far as oxygenation, you can apply any of your oxygen delivery devices to Mr. Apollo. As we're coming on down, you can listen to your heart sounds, you can listen to lung sounds, you can listen to bowel sounds. If you need to get pulses, if you need the carotid pulse, you're going to move away one flap of skin, and then you'll be able to feel his carotid just underneath where that skin fold would be. Realize that on his pulses, they're either present or absent. There is no diminished. As we move down his arm, his brachial pulse is a little bit different, and the easiest way to find his pulses is to place your firm hand across the area and then move your fingers to the exact placement where you feel the pulse. So that's our brachial pulse. Our radial pulse is farther distal. If you need capillary refill, do go through the motions of capillary refill, but as you can see, there is no color change. It will be verbalized to you. Same thing if you're doing deep tenon reflexes. Again, go through your mechanics of taking that measurement, and then it will be verbalized to you. For his blood pressure, there is a blood pressure cuff on the opposite side. If you need to oscillate, you can oscillate just below to hear the Korsakoff sounds. If you're needing to give any kind of IV medications, he can have peripheral IVs, and you'll see the arm sleeve on him is actually just to protect his skin. So you'll see that there is IV access, whether that's a saline lock or it's already infusing. You'll have that, can be again bilaterally, or there can be a CVL coming out of the right side. There's not currently one, but you can see where the hole access is that would be at. Further interventions on his torso. If you need to defibrillate, you'll see that there are large silver spikes. Those are for your hands-free defibrillation pads. And then you can see the gold spikes. Those are for your EKG leads, and there are 3. Sometimes he may have additional, like this feeding tube. If that's in there and you do see a drain bag coming out, then it is a live item that you are able to utilize. He is able to have Foley catheterization. As we come on down, you can assess for his popliteal pulse. You can assess for posterior tibial, and you can assess for dorsal pedal. Again, they are present or absent, and they'll be in both legs if that's appropriate to his scenario. He does not have capillary refill, but you can still go through the motion, and you'll be given the input as to whether or not there should be capillary refill present or not. Additionally, he'll have his monitor, any telemetry that is running. You can assume that there is attachments to him to give you that reading. With those readings, if you lose your pulse, your SpO2, realize that we do have a pulse oximeter, and it does actually have to be attached to your mannequin. If he is not attached to his finger, you will not get a reading. So if you notice that your SpO2 comes off the monitor, make sure that his pulse oximeter is actually in place. And that's our Apollo.